I know that they're saying that they're not planning to cut Medicaid, right? I reached out concerned that if any changes are made, there will be this trickle down effect that will impact families like mine.
The front lines of the Medicaid debate are right here in Courtney Leader's kitchen.
What is the face of Medicaid, do you think? And is it different than you think some people may assume?
I mean, we are the face of Medicaid.
The Missouri mother of five wrote her Republican Senator Josh Hawley to explain how slashing benefits would be devastating to her 9-year-old daughter, Serena, who lives with brain damage and cerebral palsy.
Our private insurance won't cover the formula. It doesn't cover the feeding tube pump. The hit on our budget, it would be over $1,500 a month just for the formula, just for the pump rental. And those are things that we have to keep my daughter alive. You know, without that, she's not eating. There's no way to get nutrition into her. So it's really a lifeline for our family for her to have that feeding tube.
Hawley has cited her story, emerging as a rare Republican critic of cuts to Medicaid and rural hospitals, all part of a monumentous tug-of-war over paying for President Trump's agenda.
Oh, there's my beautiful smile.
We came along for the ride, sitting behind Serena's nurse, who's funded by Medicaid, as they drove to weekly therapy sessions, also paid by Medicaid, which more than 1 in 5 Missourians rely on for health coverage.
Being a mom is not political, but this debate is political. How do you navigate the politics of this as you advocate?
I mean, I just keep consistency. I share the same story to people regardless of what side they stand on. We cannot let people like my daughter lose her benefits. And if anybody tells you that, oh, she's covered, she's protected, I would really encourage you to say how. What provisions have you made to make sure that those who meet eligibility requirements are covered?
Good morning, how are ya?
Shelley Jones has an infectious smile as she hands out food to a growing number of people in need, as deep cuts also loom for federal food aid.
Do you expect that it's tough for some people to ask for help
Oh,
and come here?
100%, yeah. But they make it so nice and easy for you and accessible.
We visited Ozark's Food Harvest, which distributes food across 1/3 of Missouri.
What is the demand like for food?
Unfortunately, Jeff, right now, the demand for food is quite a bit higher than it was even at the height of the COVID crisis. 60% of the folks that use SNAP or food pantries are from working families, and the other 40% are from seniors or children under the age of 18.
Congress is weighing billions in cuts to food assistance programs like SNAP, once known as food stamps. That will increase demand at already crowded food pantries like this.
How important is this food to you?
Well, it really helps us get through the month, and they have a good variety of things. So, and especially the fresh fruits and vegetables, I really like those.
Your husband got hurt in an accident?
Yeah, he fell between 10 and 11 feet, landed on top of his head, but it kind of changed everything. We were in the process of getting all of our ducks in a row, so to speak, for retirement, and then he got hurt really bad, and it just upside down everything. And so food pantries do that, have helped us through the situation.
Another hotly contested piece of the spending bill is deep cuts to rural hospitals. Inside a maternity ward in Clinton, Missouri, Dr. Jennifer Blair worries for her patients.
Missouri has the 4th largest number of maternity care deserts. We actually are surrounded by several maternity care deserts. That's defined as a county that has no or very limited access to obstetric services for their patients. If we were to lose that access, the birthing center here at Golden Valley, our patients would have to travel more than 60 miles to receive those services.
And 4 out of 5 babies that are delivered in our hospital are covered by Medicaid. And that's not unique to us.
Craig Thompson is CEO of Golden Valley Memorial. He said many rural hospitals in Missouri and across the country are at high risk for closure.
Is your hope for what happens over the next couple weeks in Washington in this debate?
Well, I think the thing that, again, would be beneficial is for better understanding of who Medicaid serves and what the real Medicaid face looks like. Because, again, I think that's been lost somewhere along the way.
Courtney Leader shares that hope too.
it's not a luxury. This is not a luxury. I do not have my daughter enrolled on Medicaid so that we can have fancy things. I have my daughter enrolled in Medicaid so that we can keep her alive.
What do you worry the most about what could come out of this bill being debated in this new budget? Is it the
I worry about
cutting finances or more red tape, or what do you worry about the most?
I'm worried that the red tape is going to affect our Medicaid because of just the oversight burdens, and that as a result, I'm going to lose my daughter.
Jeff Zeleny, CNN, Springfield, Missouri.